Hello, ladies and gentlemen. Today we will have an interesting talk on how therapies work based on biological intelligence. So, let me share my screen. So, we are going to talk about therapies based on intelligence, mainly biological intelligence, and that too mainly neural intelligence. Most of the time, our common medical system that is based on allopathic medicines is accused to be doing hardware level treatment only. But the therapies that we are going to talk today are doing the treatment through software level debugging. I think computer buffs will find this language more convenient to understand. So, we are going to talk on software level debugging of human body ailments. So, therapies based on intelligence. This is the ninth talk of this series based on biological intelligence. And the main therapy which comes to mind when talk of based on intelligence is homeopathy, and that's the picture representing. And it is acting through brain. It is acting through neural intelligence. Okay, so that's the focus of the today's talk. But we will be covering other therapies as well in the passing, more as a comparative thing. Yeah. So before we start talking of therapies, let us brush up. Of course, these are known things, but represented in my own way. Uh, and anything in yellow highlight is my own idea, and anything which is not that is picked up from uh, commonly available domain knowledge. Okay, so categories and level of ailments, basically based on the root cause of ailments, we see. And there could be some, of course, overlap in what I'm saying. Okay, just to classify, certain ailments are based on genetics, based on oncology, based on cheating of genetic intelligence and growth related anomalies. The example, some of the examples, of course, which come to one's mind is are cancers, tumors, acromegaly, that is oversized body parts, some kind of cysts, warts, overgrown glands, things like PCOD in females, even things like piles or muscle atrophy on the other side, negative side, where the things may shrink due to less use. Okay, so this is the category of genetic or growth related anomalies. The next category is intracellular process malfunction. So basically, whatever happens inside the cell, and whatever happens inside the cell is usually corrupted by things like viral infections, maybe most often. Okay, and then the next category is tissue or organ structure and or functionality and obstruction related issues. Now one knows of kidney stones and lung disorders, congestion related things, liver ailments, growth inside liver, sometimes even stones in liver, blockages in heart, glands, stones in kidney, bladder, gall, varicose vein. These are hardware level malfunction at the tissue level. Malfunction of epiglottis, for example, vascular infarction in heart, that I have already said, arrhythmia of heart, for example, pneumonia, things like duodenal ulcers, intestinal issues, or rectal fistula and fissures, etc. Okay, so all these are tissue or organ level functionality issues. Then next category is something which happens due to nutritional deficiency or side effect of some drugs, toxicity due to some reason, due to some overdose, etc. Yeah. And next category is, of course, related to physiological parameter related issues. For example, the blood pressure or diabetes, uric acid remaining elevated, lipids going out of the window, blood urea related issues, even things like dysentery, constipation, because these are essentially related to release of enzymes. Okay, fevers, various kind of fevers are based on physiological parameters going out. Then ionic imbalance, KNA imbalance for kidney patients and stuff like that. Yeah. So physiological parameter related anomalies. Then, of course, next category is physical damage owing to some injury or inflammation, various kinds of fractures, dislocations related to bones, ligament and meniscus related issues, contusion, compression, tear, laceration, bruise, crush injury. These are various kind of injuries apart from burns, frostbite, insect bites, skin snake bites, scorpio bites, and so on. Various kinds of ulcers. Okay, these are somewhat physical damage and injury and inflammation related ailments. And other categories, of course, impaired healing post some damage, that is basically maintenance failure in the body, starting from clotting failure to bones failing to join after fracture, wounds remaining open for a long time, not healing. Okay, and next category is due to some anomaly related to chemical messengers, secretions, and glands. Basically, all kind of hormone related issues, hyper or hypo secretion of neurotransmitter, for example, uh, hyperacidity, indigestion, basically all hyper and hypo secretions. And mainly this is more on account of chemical messengers, okay, including histamine, but of course that comes to as an allergies, that's separately classified. But generally, yes, this is one category of ailments at physiological level. Then immunological malfunctions, ranging from autoimmunity, where body starts eating its own tissues, to immunity deficiency syndrome. Okay. Then cytological issues related to composition of the blood cells, etc., and anemia. Okay. Scavenging failure, failure to clear the debris from the body due to impaired renal functions, due to liver issues, due to one symptom is of course water retention, drug not getting cleared from the tissues for a long time, usually from kidney patients again. Yeah. Poisoning and venoms and bites, self-explanatory. Then issues related to environmental compatibility, hostile temperature, exposure, pressure, explosive decompression in case of aircraft related accidents, air quality related issues, exposure to UV, X-ray, and nuclear radioactivity. Okay. Then infections and external attacks of bacteria, viruses, and parasites. Then various kinds of allergies. Now, allergies are interesting. These are usually sensitivity related issues to some neural inputs, and it is on account of some false alarm through, and it is expressed through elevated histamine level and controlled at tissue level through that. If a person has known allergy to certain flower, for example, or certain seed or certain fruit, he could get allergy even on seeing that flower on TV screen. So it's not related to smell or taste or chemical part of it. It's intelligence related disorder created through the brain. Okay, so allergy is kind of an intelligence driven or intelligence malfunction born ailment. Okay, that's an interesting class. And another class of problems are usually, I mean, things like obesity, people get being overweight or having elevated sugar level or urea level, etc. Now, there is obviously a regulation mechanism in the body controlled through neural intelligence. So, body knows how to control its own weight, what is the correct target weight, what is the correct sugar level, what is the correct urea level. But somehow this set point gets corrupted, and we don't know how to correct that set point. So we do other devious things to cure the symptoms. Okay. Also in the same category is, of course, shaky movement due to wrong PID parameters, closed loop control parameters. So the dynamic control parameters of the body movements are impaired, and we don't know how to correct it. But then if it has got a wrong parameter, it will create hunting in the movement, it will create oscillations as per engineering fundamentals. So that's what happens. And Last but not the least are, of course, neural intelligence and communication related maladies, failures, ranging from epilepsy to paralysis to cerebral palsy, autism, even small things like tongue shape control. If it fails, the tongue falls inside the throat. Psychological and psychosomatic disorders. Okay, so these are basically owing to neural intelligence and neural communication related impairment. Okay. Now, having seen the categories of ailments, let us also quickly brush up the categories of medicines and therapies that we could possibly take. Now, most common is, of course, those which manipulate the nutritional inputs, like we take vitamins, tonics, minerals, etc., or something that affects their absorption into the physiological system. Okay. For increasing iron, we take something, yeah. For increasing absorption of iron, we take iron, calcium, and something like that. Yeah. Phosphorus along with something. Yeah. And then second category is, of course, a common broad band of medications which act directly at the hardware level. That's what allopathy has been accused of, ranging from painkillers, relaxants, dilators, antibiotics, blockers. Now, these are generally, it's like if I compare with engineering, suppose a machine is having some alarm from some sensor, some limit switch or some pressure switch or something, some temperature reading. Now you just disconnect the sensor or you bypass the sensor and keep the machine running. Okay. So most of these medications are somewhat like that. Of course, antibiotics is a different category which attacks the bacteria and infection and kills them selectively, preferably, of course, uh, besides some collateral damage. But majorly it attacks the attacking bacteria, etc. So, but these are necessarily hardware level thing where the drug has to go physically at the tissue where the ailment is and then attack the ailment directly. Okay, head on. So the effect is very fast. It is dramatic, but it is not lasting. It can always reoccur. It is not curing the root cause. It is more of curing the symptoms. And it's like telling the body that there is no pain even while there is a pain. So body may not take corrective action because it does not know that pain is there, but medicine gives some relief to the patient. Yeah. So these are the categories which are generally most commonly there. And then there are those which are directly applied to the target tissue like ointments, douches, inhalers. Okay. So minimal amount of medication goes to the target tissue directly on the surfaces and treats locally. Then there are the ones. Now, the above ones which go at hardware level through blood are usually going through digestive system or through IV or IM injection, and they go through the blood, and through blood they are dispersed. So pharmacokinetics happens through the blood. Okay, so all these broadband medicines are usually in this category. There are, of course, vaccines which act at the DNA level and they alter the DNA based intelligence. So this is another category, of course, vaccines. And then there are those which work at chemical messenger level. For example, steroids, hormones replacement therapy, taking even digestive enzymes for that matter, or cofactors, or steroids, or neurotransmitter. This category, the medications which are having some effect on release of these chemical messengers will come in this category. Okay. And then, of course, even anti-allergics will come in this category because they suppress the histamine. Okay. So, and then there is a class of medicines or therapies that work through neural intelligence and connectivity. Some examples, of course, few and far between. Fenfluramine, anesthesia, medicines, narcotics, depressants, and homeopathy mainly, which is the main topic today that we are going to cover in some detail. So the question is how medicines or therapies can work through neural intelligence. Now, output from brain and nerves can contract or relax all muscles, basically, okay, motor neurons, including the muscles which do the following, that is, which make the heart tick, which make the peristaltic movement to propel food, which control breathing as well as excretion, which squeeze the glands and secrete saliva and possibly all other glands too, and they can control the secretion, yeah, through neural intelligence, and can even alter things like blood pressure through kidney. In kidney, there are cells called podocytes which maintain some pressure on the filter membrane. Yeah, so indirectly, it can, of course, influence the blood pressure. So that's okay. It happens through nerves, through neural intelligence, and through muscles. One could constrict or dilate blood vessels to alter and manipulate the local blood flow patterns. Okay, around the affected tissues. Okay. And second category is while the muscles causing external movements are voluntary, and since we get a feedback and we know how to control them, most internal body functions remain non-voluntary muscular control. So we could, with great effort, learn how to control them, but it may not be advisable or desirable for us to know how to control them. And I spoke of the reason in the previous video. If you know to control heartbeat, then for every single heartbeat you have to give command consciously. That would be a very big tax. Yeah. So there are two types of neural intelligence which are there in our arsenal. Now, one is of course the intelligence what has been learned by your neutral intelligence, and based on inputs that you have got in terms of ingress of sensory inputs, some materials, ingestion of materials, bacterias, some large molecular structures that you have got, your body has got input sometime, and whatever reaction or after effects or symptoms on the body were caused on account of those exposures, and eventually how the body got relieved from those symptoms. Okay, all that has been unknowingly registered in the neural intelligence. So we do not know, it is not the conscious knowledge, but it is subconscious level knowledge or reflex level knowledge that has already gone into the system. And apart from that, second category is of course what has been learned by your ancestors based on inputs that they got, similar inputs that they would have got. But this kind of learning has come through genetics, and the knowledge has been reverse transcripted, reverse translated, stored on DNAs, and then passed on to you. And then it has got expressed through the forward process. And through the growth dynamics, it would have influenced the neural interconnections, neural connectivity. Please refer the previous video, the last video that we had on growth dynamics influencing the neural interconnections. Okay, so that knowledge has been passed through neural interconnections through growth dynamics. It has come from genetic intelligence, and it will act more or less like a reflex action through the connectivity itself. Okay, so if you get some exposure that your ancestors had got, your body knows how to take care of that through reflex. Okay, so this is the second kind of category. Okay, of course, beyond neural intelligence, there are also other intelligence like cell membrane protein based surveillance intelligence, which prevents offender from entering the cell, virology related intelligence, and physiological intelligence and immunological intelligence that is passed on through the ancestry to match and complement the neural part of it, that is, it is downward compatible to that. Okay, so whatever offender is detected neurally, the command can go through this mechanism eventually. The immunological intelligence can support and supplement the neural intelligence, and together they can take care of the problem. So that is that. Now, talking of homeopathy, it is a science, though not recognized as one often, but because there are many riddles, there are many strange things about homeopathy. Okay. Now, one strange thing is that most of the homeopathy medicines are poisons, and whatever symptoms that poison uh, creates on when it is exposed to the person, the same symptoms get cured by the same poison being administered as a medication. So the poison kills its own poisoning. That is the strange correlation. Okay, so this is strange. Okay, strange but true. So how poison can kill its own poisoning effect? Okay, this is one trick. Then another trick is that most homeopathic medicines are poisons, all right, but it is in great dilution, and more potent the drug is, the amount of medicine is lesser and lesser because of increased dilution. And if you talk of potency above, let us say 2 m or 3 m, uh, in a dose that is administered to patient, there may not be a single drug molecule. Then how does it work? If there is not a single molecule, because we are used to allopathy medicines, which are taken in some milligrams, which have to go through digestive system, through blood, and reach the tissues through pharmacokinetics. So there has to be certain minimum dose that will be effective based on body weight, of course. But in this case, it is the dose is so minuscule that there may not be a single molecule of drug. So question is, how does it work then? Next is, in homeopharmacy, there is a strange practice that in dilution, you take a minuscule amount of drug, mix it a lot with the mother tincture or water based solution, and then depending on the potency that is required, you have to tap the whole thing so many times. Okay, so you just go on hammering so many strokes, gently, of course, but then that's what is the pharmacology practice. And the tapping seems to increase the potency. Okay, so drug molecule are very few. They are obviously not getting multiplied by tapping. So how does the potency come by tapping number of times? Okay, unless with tapping you are printing something. Okay, and we'll come to that part. Yeah. And generally, when we take homeopathy medicine, it is prohibited to use perfumes, strong perfumes particularly, strong odors, and eat anything which is having a strong pungent flavor. And generally, it is advised to avoid eating or drinking anything when you take the medicine for some time, half an hour or 20 minutes before and after, stuff like that. So, what has that got to do with the treatment? And another thing is the way the homeopaths diagnose and decide on the medication. They ask seemingly so many unrelated and irrelevant things to the patient to decide on the medication. Now, by no stretch, those things could be connected to the specific ailment that the patient has come for. Okay. So, why do they have to ask so many unrelated information from the patient? Like which side of the bed you get up in the morning, things like that. And then they observe whether the patient has square face or round face or chubby face or thin face or triangular face. What has that got to do with treatment? But then that's the way it is. Okay. So we spoke some time back of printing by tapping. Okay. Now we all know in science there is a hydrogen bond, which is the weakest possible quasi bond. It is intermittent, and it can form some structures from water molecules. When water is frozen into ice, for example, all those snowflakes get formed in different shapes through hydrogen bond. And mother tincture or alcohols can also get bonded together through hydrogen bond and water, and they can form crazy shapes. Okay. Now, what happens when a drug is kept in a mixture of water and alcohols and it is tabbed through the hydrogen bonds? You get negative replicas representing the shape of poison molecule. Okay. So in other words, you are trying to identify the poison molecule, okay, by these innocuous shapes of water and alcohol molecules, but their outline matches negatively with the shape of molecule that is there. Okay. Now see how it is. And the way the neural intelligence has learnt about those poisons in the past is also based on similar mechanism, that wherever this poison molecule was present, probably the water molecules would have got, due to jiggling, some replica. It is like molding, taking a shape of a cavity, like plastic clay. So through hydrogen bonds and water based structure, certain replicas of the shape of poison molecule shape and size, some templates have been created, and those templates have been smelled, and through the smell sensors, the olfactory sensors, okay, the nerves get some signal when they detect such shapes. Okay. And the body is forewarned that, look, this known poison is in the vicinity. So be careful, take precautionary measure in advance. Okay. So the odor receptors are typically like shape of gloves. And when some shape like this fits into that glove, it generates a click in the neuron, and that goes as sensory input, which the body has correlated already with the poison and its side effect and its remedy. Okay. So that is the neural intelligence repository which is there already, which possibly we have inherited or we have learned during our lifetime. But both ways, either ways, that intelligence is already there. Okay. So when certain poison gets detected by the body, the nerves take the action through reflex action without the brain knowing much about it or what is happening. The action is already taken to throttle various body fluids, and all the physiological parameters are modulated so that the poison will be least effective or ineffective. Okay. So that is why that theory, that whatever are the symptoms of the poison, the same symptoms get cured by the drug prepared from the same poison. So it is the neural intelligence used to the hilt to trigger the body neurally to take the corrective action against the perceived offender. Okay. Now, because patient is already complaining of symptoms of the poison, so it is assumed that he has got some exposure to that poison already. But the body knows the remedial action, and that remedial action gets triggered through neurons. Okay. So this is where it works. So the basis of homeopathy is that the effect of poison and how our ancestors would have overcome the exposure effects, that has been already learned and documented in genetics, and it has been passed on to us as our non-voluntary reflex intelligence owing to neural connectivity, the default connectivity that we have got by birth. Yeah. So, so tapping will shape the molecular structure. It will print off the poison molecule so that the molecule could be identified by the body. And more the potency means there will be more replicas, more negatives floating around in the drug. So obviously the potency will be more, and it will generate many more clicks, repeated clicks in the neurons to take the corrective action strongly. Okay, so that's the theory. And depending on potency, so many negative profiles will get replicated. Yeah, so the intensity of action will depend on that. The negative profiles get identified through the smell sensors, and neural network get ticks of proximity to that poison, as we said. And based on inherited reflex based intelligence, corrective action gets initiated through the neural network subconsciously. Okay. So, and therefore, of course, you are advised against use of strong perfumes and fragrances and anything that would interfere with the detection because it is subtle. So, stronger odors, perfumes, food should not interfere with the detection, and it should not reduce the sensitivity of the threat perception. Okay, so that's the whole point. And the basis of homeopathy is, of course, uh, voluminous literature known as Materia Medica. It's a huge reference book for homeopathy, which classifies and categorizes the brain behaviors in patients and the applicability of various medications, because the effect is not exactly repeatable. Neural intelligence is anything but repeatable, and the material, whatever will medicine will work in allopathy. We are used to trying the medicines on mice or guinea pigs or rabbits. Now these things don't work in homeopathy because neural intelligence is, of course, you cannot try it on any other species, and even within human, depending on the brain class and how the personality of individual, the behavior pattern, and the response to drugs and sensitivity, etc., will change dramatically. And that has been archived painstakingly in Materia Medica based on clinical evidence. So there are about 1200 homeopathy medicines and about 2400 pages in Materia Medica, which means about 2 pages for each medicine, which where the symptoms are given in detail, the dosage information is given, and what kind of individual traits have shown sensitivity to these medicines statistically based on empirical clinical database. So it is scientific. It is based on statistics. It is based on clinical practice. Okay. To that extent, even in allopathy, there are many things which are based on clinical trials and empirical database. Not everything is proven scientifically from fundamentals, for example. Many times, homeopaths ask unrelated questions. They just want to determine the category of individual brain class and then zero in on the likely key to the stated problem, that which medicine will fit like a key in the lock and open unlock the treatment. Okay, based on the past clinical empirical database. So the amount of medicine is so small that it does not go into digestive tract at all, does not go into bloodstream. It stays in the mouth only on the tip of sensors, the olfactory sensors or taste sensors or both. But that's what where it resides. It can't go inside. The dosage is so small that it will not go inside the body. And the medicine, as I said, is like a key. Either it will enter the lock and unlock the neural remedial action, or it will be simply a no-go case. But nothing detrimental will happen to the patient. So there is no chemical or pharmaceutical side effect. Okay, so that is what is the claim by homeopaths. Of course, we'll talk about it further. Yeah. And then, similar to homeopathy, there are, of course, some other sister therapies, like one is called as biochemic homeo practice, which is based on ions. So there are some 12 salts listed here from public domain again. And Generally, they say in literature that there are 12 basic vital salts, and imbalance of these salts in the body is the root cause of ailments. So, through therapy, they try to address the imbalance of salts to cure the problems. So far, so good. But then one would say that these are like vitamins or minerals, which even allopaths practice, nutrition people practice. But then this is nowhere near that. This is something quite different. Okay. Because the way it acts is probably through taste rather than the mineral going into the blood stream up to the tissues, because the dose is again so small. Okay. So it is acting neurally through mouth, because all those cares are still there, that no strong perfumes, nothing to be eaten, nothing to be taken orally while having this medicine for 20 minutes, half an hour, so and such like, before and after. So all those cares are still there, which means that it is still based on sensors in the mouth cavity. Okay. So most probably it works through the taste of these ions. We don't know the taste of ions, but the body knows. Okay. And like homeopathy, it triggers a neural mechanism through taste sense rather than through olfactory sense. Olfactory sense, of course, the molecule will be bigger. Now, these are much smaller molecules almost. These are inorganic. Okay. So, they will not create an odor. The odor sense is aromatic compounds are much bigger than these kind of salts in molecular shape and size. So, these are probably detected through taste, and the pharmacy practices and diagnosis is still same to homeopathy. So it's not like taking minerals. Yeah. Most probably the action happens through neural intelligence only. However, it is, as compared to homeopathy, it is more generic and thumb rule based. Usually, same medicine, same salts are applicable to all. So here you do not have to go to the peril of identifying the brain class by the habits and traits, etc. So that part is not there. But generally, these are more universal kind of a thing. They work on everybody in the similar way, per empirical data. So, but yes, this is also something which works neurally through senses, and it's not so much individual type focused as homeopathy. So that is one point of difference. There are some other similar therapies. Like there is a variation called as electro-homeopathy. And electro-homeopathy uh, has evolved from some Greek theory that there are some fluids called as humors in the body, like aqueous humor, vitreous humor in eye. Now, those humors, it's not humor, and it's not related to comedy, it's related to body fluid. So, the four body fluids that are identified are blood, phlegm, yellow bile, and black bile. And they say imbalance of these four fluids are the causes of root causes of all problems. And they are, the imbalance is sought to be corrected by some herbal based medications, and sometimes those herbal extracts are also energized by passing electricity through them. So they are, the energy level is elevated by passing electric current through the drug formulation. Okay, but most of these medications are derived from plants and they are herbal based. Okay, so but still it is a concept which is not recognized by conventional science. So, but in a sense, neural activation to control the humors is probably triggered by herbs or electricity modified herbal content, and probably it is identified again through taste or smell, similar to homeopathy. So to that extent the word homeopathy has been suffixed here. Yeah. So though it is herbal based, it's not poison as against homeopathy. It's not iron like biochemic, but it is some herbal based formulation which is good here and potentiated by electricity. Yeah. So that is a sister therapy. And there are some alternative, of course, neural assisted therapies, like can talk of herbal based drugs, Ayurveda or Unani, which probably act through the brain by altering the balance of hot and cold, because most of these medications have some concept of hot effect and cold effect of drug, and they again act through the system of phlegm, liver, we call it pith, vat, or vayu. So Ayurveda is about correcting the balance of kaph, pith, and vat. Okay, and in Unani also something similar. It is in Urdu, Soda, Safra, and something I don't remember. Two more are there. Okay, but it is essentially similar. But most of these herbal-based things are probably the drug is taken not as a nutrient, but it is taken as a more as a data, and it works through neural intelligence more than physically the drug going to the tissue and acting there directly. Okay. Then, of course, there are physiotherapies and baths and massages and yoga and acupressure. They most of them work through altering the blood flow patterns, usually influenced through muscular workout and shape change in the body, postures, etc., and some heating and cooling into the bath and some additives in the bath fluid, etc. But they are all probably working through the nervous system, okay, and muscles, affecting the blood flow, and through the blood flow, they are curing the ailments. Then there is, of course, something similar to homeopathy, a perfume therapy. It is probably same as homeopathy, besides the diagnosis part and the pharma part. And I use various kinds of strong perfumes to cure something based on empirical database. Then there is a gem therapy, which appears to be more like a placebo, because these not all gems are crystal, so that they will resonate at certain frequency of electromagnetic waves, etc. Though that theory is often propounded that it is generating some vibrations which correct the body. Now, the amorphous gems cannot do that, obviously. Crystalline ones like diamond or ruby could probably do that, but not all. And what do they do? Okay, they will resonate and they will create some vibration in the blood, and then how it will affect the blood, I mean, is not researched. It is not giving energy to the blood because there is no energy in the gem itself. It is just resonating minus the energy. The energy has to come somewhere, can't come out of nothing. So it is more like a placebo, but probably acting through neural activation. Okay, because even placebos sometimes work, and they work through neural control, through intelligence. Because patient thinks that he is being given some medicine, whether it is medicine or otherwise, the body takes some cognizance of that, and something happens through neurons. Then there is something similar, hypnotherapy and Reiki. So if at all, these could only work through neural influences commanded through voluntary control. Okay, so it cannot be directly going to the tissue level or doing anything. Though they talk high-sounding spiritual terms like cosmic energy, but in physics there is no cosmic energy. In engineering, we don't talk of cosmic energy. Okay, and cosmic energy does not influence the body directly. Okay, so there is another category of therapies which is based on needling. Now, in the previous video, we talked about association areas, etc., where if the needles are pricked, it has some effect on some target organ or tissue. So, needling on target muscles, basically, the body has been mapped on soles and palms and earlobes that we saw in the last video. We can still see one slide on that. But working on the mapped area, the neural mapped area through needle or through massage, probably can alter the blood flow pattern in the target tissues or organs, and could be further aided. Of course, dry needling is often aided by ultrasonic healing or thermal fomentation also to relieve pain. So needling is known to take care of the pain. Physiotherapists do needling. Then there is a sophisticated version of that called acupuncture, which is not directly. Needling is done on the tissue directly, which is affected. So wherever there is a pain in the muscle, there you have to put the needles, or somewhere around that where the blood supply is going through that. But in acupuncture, it is on the mapped area, like on palms, on earlobes, and so. There, the ailments are, if it acupuncture is applied, the functioning of the target organ is slowed or accelerated, depending on what is done by the needles. Okay, so there is a variant of acupuncture also. It's called electro-acupuncture, where they use gold and silver needle to have positive energy or negative energy, so to say, and they have different effects on the ionic release which they cause, and sometimes even small current is passed through the pair of needles. That's called electroacupuncture. Of course, not many people know this, but then this is also one therapy which is practiced. Now, these are, of course, the acupressure reflexology chart taken from public domain. So this is just showing the association areas or the mapped areas where if massaging is applied or needle is applied, then there is some effect on the target organs as mentioned here. So this is obviously acting through nerves and through blood flow system. Okay. So electroacupuncture uses two needles and some current is passed, and it helps to block the pain by activating the bioactive chemicals. It may decrease sensitivity to the pain, so it may have some anesthetic effect, and it is known to reduce inflammation. The body releases endorphins, which help to reduce inflammation. Now, this is a physical correlation. The activated nerve fibers also help to reduce feeling of persistent pain. And studies have also found that electroacupuncture is known to release mesenchymal stem cells into the bloodstream, which do the healing part. Okay, so they promote the healing with that way. So essentially, acupuncture and electroacupuncture is more, and needling in general is more to do with pain related issues. Okay, pain and malfunction related issues related to target organs and tissues. But of course, the care is that epileptics and pregnant ladies and those who use pacemaker should not be using these kind of electric therapy. So, uh, in the end, yes, there are some questions which are could be asked, of course. Like all these therapies which we have discussed, can they cure cancer or tumor growth? Now, the thing is, initiation of problem and spread obviously may not get controlled because it is genetic origin and intracellular origin. Now, neural intelligence cannot go inside the cell and correct anything. But however, it can block, it can throttle the support and supplies to the tumors or growth areas, and it could throttle them to eventually restrict and degenerate them. So, initiation it cannot control, but probably growth also it may not control, but the severity it can control, and it can help to get rid of them faster. So, next question is, can the viral and bacterial infections be cured? No. How can they be? Uh, Not through neural intelligence, obviously, but through immunological intelligence, which is another variant of biological intelligence, which again you have acquired through the ancestors, immunological intelligence, or by vaccines. It is expressed through vaccine antibodies and limited exposure to the offender. So, yes, but it's a different branch of intelligence. It's not neural intelligence, obviously. Yeah. Can physical blockages like kidney stones, etc., be cured? No, not directly. Can allergies be cured? Yes, certainly. Because it's a neural level root cause. So, obviously, 100% it can be addressed. Okay. Can physiological parameters and regulation related maladies be controlled? Yes, but it will involve a lot of learning effort and enforced regimen, also including use of some medication along with this treatment. So yes, to some extent, yes. Right. Can pain be controlled? Yes, for long-standing, moderate level of pain, but obviously cannot substitute the anesthesia during surgery. Okay, so to that extent, yes. But long-standing dull pain, etc., yes, it can take care. If the pain is not too severe, yes, it can be. Including orthopedic pain, probably, yes, it can do something. Can the organ failure and tissue impairment damage be controlled? Most certainly no. How can? Okay. Can deficiencies and toxicity be controlled? Deficiency certainly no, because if something is not there, it is not there. What can neurons do to make it available? Toxicity and symptoms can get controlled to some extent. Can hyper and hypo secretions be controlled? Certainly yes, because muscles can control the secretions by pressing the glands or releasing the glands. Yeah. The last point is many times these therapists who practice these kind of therapies, alternative therapies, claim that while allopathy has a lot of side effects and reactions possible, these therapies have no reaction or side effects. Now, the problem is that allopathy medicines have been well researched and trial on mice, trial on animals, and the human trials. So everything is established. The mechanism of action of drug, even the pharmacology wise, precise amount of drug is mandatorily mentioned. Where in other therapies there is no such mention. In Ayurvedic and all, how much drug is there is not mentioned anywhere. So other therapies often summarily claim that they do not have a reaction or side effect. Okay. Now, to puncture that claim, anything that has action would also have a reaction, that is physics. And anything which does not have reaction probably will not have action either. So, because through medicine, if you are disturbing something in the body, there will be some side effect or some reaction. Yeah. If drug is doing nothing, then of course nothing will be there. Yeah. Just because the reaction or side effect has not been studied or documented and does not mean it is not there. And a known reaction of a drug and having a knowledge of proven antidote is much better choice, I mean, personally, than prospects of an arbitrary reaction that would not even be acknowledged. Yeah. So the last word, anything based on past empirical data, all these medications are based on the past empirical data. It is fraught with one common feature, be it allopathy, homeopathy, acupuncture, tris, or astrology. Now, tris is science of innovation. It is an engineering term. So I have just thrown in here. Astrology, of course, all of us know. All these things are based on, to some extent, empirical data. Okay. Now, anything based on empirical data is having an implicit assumption that whatever then work then will also work similarly now. Now, whatever work then may not work similarly now. That is the problem. Because of late, what has happened at the pace of change in our exposure, lifestyle, our biological intelligence software has been so much that whatever came naturally to us once is far from our new norm of natural. We are all exposed to drug dependence, drug habituation, with drugs, with food, with chemicals, pollutants, staring at blue screen and electromagnetic smog. So things may not work the same way as they worked in the empirical database. So that is the last word. And I hope you have liked the video. And please watch out for our next video, which is on similar topic, but not related with therapies or medications. It is related with food and nutrition. The title is that food is also data. Okay, so stand by till then, and please watch the next video. Until then, bye bye, good luck.